It is a question that everybody has, and it's also perhaps one of the most important questions because we know that fear about the vaccine or concern about vaccine safety is a leading reason why people are choosing not to get immunized. So, if I had to answer this question in one sentence, the answer is that we know that the vaccine is a lot safer than getting COVID-19 infection. So, it's really important when we talk about the risks of the COVID vaccine that we keep in context what we know that the risk of not being vaccinated is. And we're seeing continued high rates of COVID transmission. We're seeing still really high rates of complications and mortality, particularly in our most vulnerable population, including older adults, people with heart disease and diabetes. So to put that in context, relative to that, the vaccines are incredibly safe. So, for a little bit more detail, just so that the audience knows, each of the currently available vaccines that we have in the United States have been studied in clinical trials of about 30 to 40,000 patients. So these aren't vaccines that we don't know a little bit about. We actually know a lot about their vaccine safety, particularly due to the size of the clinical trials. Beyond that, we have a number of systems in place that monitor vaccine safety even after the vaccine is being given to the public. And we know that tens of millions of Americans have already received the COVID vaccine. I think the latest number I heard was over 90 million doses of COVID vaccine has been given in the US. So we know a lot. So what do we know? Well, the first thing we know is that there is a risk, a very rare risk, of a severe allergic reaction called anaphylaxis. The good news for that is that it happens usually soon after you get the vaccine, and it's very treatable. We know how to treat allergic reactions. And that's why you're asked to wait 15 to 30 minutes after you get your vaccine before you leave the vaccination site. Other side effects that we're seeing from the vaccine, none of which are life threatening, tend to be things that are related to your immune system actually mounting a response. So, frequent side effects are things like fatigue, headache, low grade fever. It's very common to have a sore arm or some pain around the injection site. This usually happens within the first day or two and is usually gone within a few days. So it's sort of uncomfortable. You might plan to take it easy, especially after the second dose when the rates of side effects are a little bit higher after the second dose compared to the first. But it's nowhere near how bad you'll feel if you get COVID infection. And the good news is when you have those side effects, it means that your body is recognizing the vaccine and is building up those all important antibodies to help protect you from severe infection.